Greetings. I am Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings. I am pleased to welcome you to the multimedia summary of the journal's May 2017 issue. This month there are 4 articles designated either as Editor's Choice or Highlight Selections. Our Editor's Choice this month is an original article authored by Dr. Shannon Dunley from Mayo Clinic, Rochester, Minnesota, and colleagues from the Duke Clinical Research Institute, Durham, North Carolina, and the University of Mississippi Medical Center, Jackson, Mississippi. The authors examine the association between perceptions of discrimination and cardiovascular disease outcomes in African Americans using data from the Jackson Heart Study. The study included 5,085 African Americans who were free of cardiovascular disease at baseline and who had completed a baseline discrimination questionnaire. The authors found no association between perceived everyday or lifetime discrimination and the risk of cardiovascular disease events. An unexpected lower risk of all-cause mortality in those with higher levels of perceived everyday discrimination was observed, a finding that may be linked by perceived stress. These data, interpreted in the context of prior studies, support that perceived discrimination may be associated with the development of near-term cardiovascular risk factors such as hypertension, but is not a strong factor in the long-term development of incident cardiovascular events or all-cause mortality in African Americans. The examination of potentially modifiable behavioral, psychosocial, and clinical factors that comprise the causal pathways of these associations is critical in identifying ways to treat individuals at the highest risk of discrimination so as to optimize outcomes. The authors suggest that institutional forms of discrimination may have a greater effect on cardiovascular disease outcomes than interpersonal discrimination. The article is accompanied by an editorial authored by Dr. Keith Ferdinand from Tulane University School of Medicine, New Orleans, Louisiana, and Dr. Samar Nasser from George Washington University, Washington, D.C. Drs. Ferdinand and Nasser examined the disproportionate cardiovascular disease burden in African Americans and considered factors influencing the unexpected results found in the Jackson Heart Study. They point out that the Jackson Heart Study discrimination instrument was the first psychometrically sound, multidimensional measure of perceived discrimination for use in health studies. However, as also noted by the developers, limitations may reside in its generalizability beyond the southeastern United States and by the lack of measures of institutional and internalized discrimination. Drs. Ferdinand and Nasser rightly emphasize the need to carefully study discrimination and racism in healthcare work, writing, research, and interactions with patients and colleagues to both better understand its impact and to combat its pernicious effects. They also emphasize the need for further research to more clearly elucidate the impact of racism on cardiovascular disease in African Americans, especially the adverse effects of persistent system-related disadvantages. Our first highlight article in the May 2017 issue of the Proceedings is a review article on urine drug testing, authored by Dr. Karen Moeller from the University of Kansas School of Pharmacy, Lawrence, Kansas, and colleagues from the Harding University College of Pharmacy, Searcy, Arkansas, and Skaggs School of Pharmacy and Pharmaceutical Sciences, La Jolla, California. This review provides a very helpful guide for clinicians when interpreting the results of urine drug tests employed in detecting such misuse substances as cannabinoids, central nervous system depressants and stimulants, hallucinogens, designer drugs, and herbal drugs of abuse. The authors discuss how false positive and false negative results may arise, and that certain methods of detection, such as immunoassays, may require confirmation by more specific techniques. Also included in this review is a discussion of the detection of alcohol and tricyclic depressants and the biochemical pathways underlying the metabolism of opioids and benzodiazepines. The authors conclude that urine drug tests are invaluable for clinicians when assessing unexplained symptoms and findings, in monitoring adherence, in treating patients with addiction, and in prescribing controlled substances. However, it is important, as emphasized in this review, that clinicians have an appropriate understanding of urine drug tests so as to avoid and minimize misinterpretation. The authors caution that incorrect interpretation may result in legal consequences, unemployment, inappropriate medications, and possible dismissal from one's healthcare practice or school. The second highlighted article in this month's issue is an original article authored by Dr. Gabriel Maciel from Mayo Clinic College of Medicine and Science and the Maciel Hospital, Montevideo, Uruguay, as well as by colleagues from the divisions of Rheumatology, Biomedical Statistics, Epidemiology, and Pulmonary and Critical Care at Mayo Clinic College of Medicine and Science, Rochester, Minnesota, and the Rheumatology Department of Brest Teaching Hospital, Brest, France. The authors reviewed the incidence and mortality rates of primary Sjögren's syndrome in Olmsted County, Minnesota, from January 1, 2006 to December 31, 2015. They combine these cases with those from 1976 to 2005 incident cohort. The data were mined from the Rochester Epidemiology Project to encompass a 40-year study period. Primary Sjögren's syndrome is a systemic autoimmune disorder with its principal symptoms including mouth and eye dryness, marked fatigue and pain. The etiology, epidemiology, and incidence rates of primary Sjögren's syndrome are not well understood or defined. The authors hypothesize that the etiology probably includes environmental triggers in genetically predisposed patients, as illustrated by its familial aggregation and predisposing genetic variants. To date, no disease-modifying drugs have proved effective in reducing the symptoms of primary Sjögren's syndrome or in improving the natural history of the disease. A notable conclusion of this study is that in contrast to other studies, the overall survival of patients with primary Sjögren's syndrome in Olmsted County, Minnesota was no different than in the general population. The third highlight in this month's issue is an original article on adult recipients of a total artificial heart, and one that is authored by Dr. Aaron DiMartino from Mayo Clinic College of Medicine and Science, Rochester, Minnesota, and by colleagues from Mayo Clinic in Minnesota and Arizona, as well as Oxford College, Minneapolis, Minnesota, the University of Wisconsin in Madison, and the McLean Center for Clinical Medical Ethics at the University of Chicago in Illinois. The authors undertook a retrospective chart review of all adult recipients of a total artificial heart at Mayo Clinic from the program's inception in 2007 to June 30, 2015. Their paper provides an overview of the history of the development of the artificial heart, the statistics underlying its implementation, a description of the process for implantation, and the attendant survival rates. The authors discuss the potential life-extending benefits provided by the total artificial heart, as well as such risks as infection, hemorrhage, thrombosis, and multi-organ failure, all of which may preclude heart transplantation. Importantly, the authors explore relevant ethical issues. Specifically, based on the patient's experiences they studied and on comparisons with the withdrawal of other life-extending treatments, such as the ventricular assist device, mechanical ventilation, and hemodialysis, the authors conclude that withdrawing total artificial heart support is morally justifiable under the similar conditions that would justify the withdrawal of any other life-sustaining therapy. Finally, they emphasize the importance of pre-implantation advanced care planning for all recipients of the artificial heart. You may access these highlights and Editor's Choice articles free of charge during the entire month of May. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org and review some of the other free content there. You can access the social media buttons near the top of our homepage to follow us on Facebook, Twitter, and YouTube, where you can remain current on online first publications that are introduced on our website between the monthly issue updates. Our website also lists many news stories that are based on articles published in Mayo Clinic Proceedings. On YouTube, you could find video content such as full author interviews, our 60-second video article summaries, and also on our homepage, you can access our Mayo Clinic Proceedings fireside chats, which are available through iTunes in addition to access from our website. As always, thank you for your interest in and your support of Mayo Clinic Proceedings.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.